Morning, everybody. So we're back again with yet another presentation that is a continuation of how to communicate with patients having communication disorder. I welcome you back to Speech Rehab RS channel. Okay, starting with the slides. It's a well, when you're communicating with people having communication disorder, we have described in a previous slides that you have to take customize and a different approach as compared to patients who do not have any communication disorders. So the frame training model is basically training program that is used or that contains or lie down the principle that can describe the methods to communicate with patients having communication disorder. Okay, the frame training program is based on common clinical techniques used by speech and language pathologists, as well as research documenting the experience of patients with communication disorder in healthcare, and recommendation from patients to improve for improving patient care. There are 5 key areas of communication accommodation for patients with communication disorder. These 5 principles are applicable to most people with communication disorder, although specific tool and technique may vary. Most people with communication disorder benefit from multimodal communication modes of communication are combined with speaking, listening to convey information. However, the specific modalities that are helpful differ across the disorders. For example, an alphabet board can be helpful for someone with reduced speech intelligibility, but relatively intact cognitive linguistic abilities to spell a message, whereas someone with aphasia may not be able to use a spelling board due to the language processing difficulties. Okay, here I will give you an example. First, suppose you come across a patient who is diagnosed with dysarthria. Dysarthria is a speech disorder in which, due to oral motor weakness, there is decreased intelligibility, even though the patient is cognitively or the language processing in the brain is fully intact. So here you're gonna get the message across through an alphabet board. The patient may point out the letters or the letter of the word he's saying. On the other hand, in case the person is suffering from aphasia, which is a language processing disorders, the alphabet board might not help him. So you would have to give him a pictorial board in which there are pictures or symbols, and you need to do some training prior to using that. Whereas in case of dysarthria, the patient might quickly adapt the alphabet board by himself. Okay, the frame mnemonic, as previously described, the frame consists of 5 principles. One principle that is like the frame F, that is familiarize yourself with how your patient communicate before starting medical interaction. Ask patient or SLP about preferences of communication or existing strategies. Assess how well the patient can understand what you say. Asking the patient if he or she can understand you is not a reliable assessment, because if you ask the patient that are you able to understand me, there is a chance the patient might not even understand. If you are like, what did you mean by saying that you understand me, they might say yes. He might have language processing issue, that's why he won't be able to understand the or comprehend the meaning of when you said, did you understand me? So you need to be very careful. Ensure the patient has a way to express himself or herself. You can then again ask the SLP or the patient or the attendant, or what was the given strategy by the SLPs for that, so that he can express himself. Clarify the role of others present, like that is the family, and if the patient wishes them to be involved in helping communication, in with communication, well, there as explained before in the slides, that it's like a common practice that you ask the patient and the family members or the caregivers just try to jump in and help them out. It's a wrong approach, because this is going to demotivate the patient. So do try to explain that what is the role of primary caregivers here, and where the patient needs to express himself, like he needs appropriate time, he needs appropriate reaction time, that is, to express himself and tell the family members not to get involved in assessment until asked so. R. Reduce rate. Okay. Allow the patient sufficient time to process information and formulate response, generally 2 to 3 minutes. Okay. As explained in previous slides, it's one of the common medical errors that when we are communicating with the patients having communication disorder, we tend to do it at the normal pace, or like we're too fast in speaking. Whereas when you're communicating, you need to slow your rate. Speaking slowly and short chunks of information if the patient has comprehension problems. You know what? If your patient is having comprehension issues, and if you just use the strategies, you're gonna be like you're gonna be literally impressed how well the patient can respond. So even though the patient is having Wernicke's aphasia, or having any other fluent type of aphasia where the comprehension is impaired, you're gonna get the response. So hopefully you're gonna get the response. This helped me a lot in my clinic, so do try it with your patients as well. Have an attitude of patience and reassure the patient it is okay to take your time. Oh yes, that's a very big point here. Or suppose, you know what, if you positively reassure your patients, yes, they will try again to communicate. So this will help you get the response. If you're like, no, you did wrong, no, oh, you should say it again, it's going to highly demotivate the patient, and the language gets worse when the patients are under stress. So be very careful, please. A. Assist patient with communication. I hope you went through the last lecture in which I said that you have to give, like, you need to create a balance, okay? You don't have to restrict the patient, overly restrict the patient, or you don't have, like, leave patient without any aid. So be willing to step forward to help with communication. Do not sit back and wait for the patient to fix the communication breakdown. And how you can do that? By giving them the phonemic cues, by giving them the options. Like if the patient want to say, I had like biscuits for lunch, and you might have like guessed it somehow because you saw the biscuit wrapper on his side table. You can give him the phonic cue like wait, and then you can give him the phonic cue like look at here, B, and then he'll suddenly say biscuit. So it helps patient, and he feels the sense of achievement with this. So do try this as well. Confirm understanding, correct understanding of the message. I can do it often because, like, for suppose if the patient said, I want biscuit, I ate biscuit, and you just understand, yeah, like my patient wants biscuit. It's okay to ask, like, did you say that you want to have biscuit? So it's gonna give a quality to your assessment and communication. Let patient know when you do not understand something. Do not pretend to understand when you do not. Well, you might be surprised, but patients do know, and especially people with communication disorder, that they're pretending. They did not actually understand. So it's okay to tell them, yeah, can you say it again? Sorry, I did not understand. Okay, so it's gonna like help them motivate them further. Be true to your patients, like especially people having communication disorder. Be flexible to try different strategies until you find something that works. The same patient may need different strategies at different times. Some patient might respond to phonemic cues, or some may respond to options. So try different strategies, especially as a speech therapist who is like trained in this matter. Use the least restrictive accommodation. Least restrictive means avoid using strategies or aids that is gonna channelize the patient's response, like closed questions. Like, do not limit the questions to yes or no response if they are able to communicate more than that. M. Mixed communication method. Do not rely solely on speaking and listening. Show, don't just tell. Use body language, gesture, pictures, writing, drawing to supplement spoken language. You can also use gestures. Have communication aids, picture boards, alphabet boards, whiteboard, pen and paper readily available for patients. Customized picture boards for the vocabulary and concepts to use in your setting. Use different modalities to help patients with comprehension problems. Understand what you're saying. Encourage patients who have expressive impairments to use these different modalities to help them convey their message. Allow extra time for the patients to use augmentative, alternative communication devices to enter message into the device. And the last principle, E, engage patient to respect autonomy. Speak directly with the patient. The family members should help you communicate with the patient, but they should not communicate for the patient. Do not talk down to patients. Keep your tone voice neutral, respectful, and appropriate to the age of the patient. Do not try to treat them as a child. Use appropriate language. Ask patient if it's okay to guess as what they are trying to communicate. Some patients regard guessing as rude interruptions. Interact with patients as you would other patients, including social banter, to build rapport, providing full information and education. It's really a good approach to go tell your name, your profession, your purpose to coming, and so do try doing that with the patient as well. Conclusion. Approach the healthcare provider to patient with communication disorder should be considered unique and specialized as compared to approach towards the patient without communication disorder. A speech and language pathologist is trained in such approach. So wherever communication difficulty is faced be by any professional involved with such patients, speech therapists should be sought out for help. So these are the references, and thank you all for listening to this first session that was divided into 2 parts. Do go for the part 1, and I hope you liked it. We're gonna make a lot of improvements in our next slides as well. I can understand, and do drop your questions, your queries, your any sort of suggestions down below in the comment section, and do try, and if we had any, if we were unable to get our message across appropriately, we'll try our best to cover up the stuff in the next slides or section. So that's it, and good day to you all by Speech Rehab RS. Goodbye.